community for Christ through health. So it should be very good. And so we'll go ahead and get started. And I do want to say, if you have any questions along the way, it's always more, if you have any questions, feel free to raise your hand, ask me a question. I think people get more out of it if you have a question, and that keeps things a little bit more engaging. So we promise that every day here you'll learn something new, and we'll try to be very evidence-based in what we present. But let me say one more word of prayer before we start. You're good. Okay. Let's bow our heads. Father in heaven, we're so thankful for this day of life. We thank you for camp meeting, the opportunity to come together and to fellowship. We just pray your blessings on what is done today and this week, here and in all the other seminars, that you would be lifted up. We pray this in Jesus' name. Amen. Amen. All right, so we're talking diabetes today and peripheral neuropathy. And the reason that I kind of got into this, I'm doing a study with a primary care doctor on diabetic peripheral neuropathy, of which we have 3 people who have been in this study. And so I'm going to talk just some background on diabetes, and then we'll get into this neuropathy, and invite, then Dr. Tryon is going to interview the folks here. So I just want to give credit. Is anybody familiar with nutritionfacts.org? And if anybody's so I use a few of their slides. My slides come from some of their graphics. But so I do want to give credit. They allow for people to use it as long as you give credit. And so I'm going to talk an overview of diabetes, helpful hints, complications in the current clinical study that we're doing. So, an overview. Can anybody guess what % of the U.S. has diabetes or prediabetes? You combine both people with diabetes and prediabetes. What % of people in the U.S.? Okay, I'm hearing some. All of them. Okay, pretty close. So if you add it up, 80. So that's pretty close. It's right at 50. Around 50% of the U.S. has either diabetes or prediabetes. So if you don't have diabetes or prediabetes, you know somebody that does, right? It's a common thing. About 12% of the population has diabetes in the U.S., and 38% have prediabetes. So count that together, 38, about 12. That's about 50% of people have either diabetes or prediabetes. And what % of people with prediabetes go on to have diabetes? Anybody want to venture a guess? If you have prediabetes, what's the likelihood that you would have 80%, I heard, 50. All right, I think you're right there. It's 70%. So if you have prediabetes, it's very likely that you'll go on to have prediabetes. If you have prediabetes, you'll go on to have diabetes, I should say. Okay, so an overview, type 1 diabetes is an issue where the pancreas is not producing enough insulin. It's an autoimmune attack on the pancreas. Type 2, the more common type, 90 to 95% of people who have diabetes in the U.S. is type 2. There's insulin resistance in the cell. So you have insulin, but it's not receptive. The muscle cells are not receptive. So if you go back 100 years ago, this is an article from 1927, Archives of Internal Medicine. So I'm going to get a vote here on this. There was 2 groups in this study. There was they put people on a diet for 2 days, and then they gave them a glucose or fructose tolerance test. They gave them a bunch of sugar. And then they saw who had worse outcomes or who had better outcomes. One group was a high-fat group, and they received, I'll highlight here if you can see, only olive oil, butter, mayonnaise made with egg yolk and 20% cream. Those in the carbohydrate group were allowed sugar, candy, pastry, white bread, baked potatoes, syrup, bananas, rice, and oatmeal. So there was a fat diet for 2 days, and there's a carbohydrate diet for 2 days. And then they gave them a lot of sugar. So who do you think did worse? So let me get a show of hands for the carbohydrate group. We're looking at, so you think carbohydrate. Okay, how about the fat group? Anybody who would vote for the fat? We got an even split. So let's look. So this is 100 years ago. And what did they find? The fat group did worse. Interestingly, if you look here, this is the fat group. Their sugars spiked much higher than did those who had eaten all the sugar, all the carbohydrates. So you think just a little bit backwards what you might think. the fat did worse. And this is 100 years ago. And interestingly, the higher the fat content, these are individual patients here, the worse were their sugar spikes. So there was a correlation, fat intake with glucose being worse. And now, so that's 100 years ago. Now we know that insulin resistance, which is type 2 diabetes, is now accepted to be closely associated with lipid accumulation in the muscle cells. Fat in the cells causes insulin resistance. If you put fat in the cells, that causes insulin resistance. And how does insulin work? If you can see that on the screen, one of the left or right there. So you have insulin, and it comes to a muscle cell here, and there's an insulin receptor. And that activates a number of enzymes within the cell that then activates this glucose transport, and then glucose can come in the cell. So that's how it should work. In the setting of a lot of fat within the cell, these yellow things here are supposed to represent fat. The insulin comes, it comes down, but these enzyme reactions are blocked. And then it cannot open the glucose transport. So it's fat within the cells, which is the underlying cause of diabetes. Intramyocellular lipids, so fat within the cells, is the underlying cause of insulin resistance. That's why 100 years ago, why the fat group did worse. And it's been shown, and these are in more recent studies, fat within the bloodstream causes insulin resistance. Fat in the cells, this is a nuclear medicine spectroscopy study, and I was just talking with Chris here, who does this for a living. This is like an MRI. They look in the cell, and they notice when there's higher fat in the cell, it correlates with more insulin resistance. So fancy techniques, MRI technique to look within the cell, and when there's more fat, sure enough, there's more insulin resistance. Again, yes, please.
I have a question. Since we're talking about fatty acid increase in the cells, can't hear you.
I'll repeat the question. We have a question here, so I will repeat the question once he says it. Go ahead.
Why is there an increase in fatty livers now in people who are diabetic?
Oh yeah. So I'll come to that, but I'll try to answer that. But yeah, people with diabetes, the fat gets within the pancreas and the liver. The liver produces glucose, the glycogen breakdown, and it becomes also insulin resistant. And so it keeps producing glucose when it shouldn't be. Like if you're fasting, the liver produces glucose, but when it has a lot of fat in it, then it produces more glucose even when it shouldn't be. So there's some insulin resistance within the liver. So good question. Did I repeat the question? I'm sorry, I didn't repeat the question. He asked, why do people with fatty liver, how is that associated with diabetes? And the answer is what I mentioned. People who have fatty liver, it's insulin resistant. It's not sensitive to insulin, and it's producing glucose when it shouldn't be. So there's a tie-in there with fat within the liver also as a cause for type 2 diabetes. Yeah, feel free to stop me along the way if you have a question. I may or may not be able to answer, but I'll try. So this was a study that showed after a single day of excessive fat intake, it reduced insulin sensitivity. So a single day, there's more reduced insulin sensitivity. But not only just after a single day, this next one showed one fatty meal, they checked 6 hours later, it led to insulin resistance. So within 6 hours, this study suggested. And then not only within even 6 hours, this study within 2 hours, after a fatty meal, there was insulin resistance. It peaked at 6 hours, but within 2 hours, they noticed insulin resistance. And another study showing the same thing, increased fat within about 2.5 hours, 160 minutes, there was increased insulin resistance. So it occurs quickly. It doesn't take weeks or months. It's within hours that you start getting insulin resistant. Can you all hear me in the back? Okay? Okay.
Yes.
All right. Yes. Oh, yeah. Okay, so the question is, what about keto diets? So come tomorrow and you'll hear. So come tomorrow. That's the topic. We're going to talk about keto diets quite a bit tomorrow. Oh, yes.
My question is this. Should people who are diabetic be fasting?
Okay, so We're going to talk about that again also tomorrow. We'll talk about intermittent fasting. There can be some, the question was, should people who are diabetic be fasting? There are some, I might defer to some of my primary care colleagues here, but there are some concerns if your glucose are fluctuating, and so you have to be kind of careful with that fasting if you're diabetic. But we're going to talk about intermittent fasting tomorrow. What are the studies on that?
So
One more question. Yeah.
if someone is on that fatty diet for a long period of time, will they incur diabetes eventually?
Okay, so I have a slide coming up. The question is, if you have a bad diet, a lot of fat over time, will they necessarily always get diabetes? Is that the question?
Will they eventually get diabetes?
Will they eventually get diabetes?
Is there a chance?
Sometimes there's a genetic component to it as well. So you're adding, the odds are not in your favor if you continue to eat like that. Some people are lucky and they don't, but you're not helping yourself if you do that. All right, so this is just another study where they did an infusion of lipids, of fat, in young adolescents, African American and Caucasian. They saw the same thing. It was an overnight infusion of lipids, and there was reduction in insulin sensitivity, more fat within the cell overnight, and then they noticed reduced insulin sensitivity. So again, going along with what we said, fat is bad for insulin sensitivity. And just the opposite happens. If you reduce fat in the bloodstream, it actually improves insulin sensitivity. So if you eat less fat, it's actually better. This was a medication to reduce fat, and sure enough, the insulin sensitivity improved. All right, so the question here is, do you think animal versus plant fats make a difference? Does that impact insulin sensitivity? So I'm seeing, what are your thoughts? Does it make a difference if it's an animal fat versus a plant fat? Okay, it does make it. I think everybody's saying yes, and that is correct. That is correct. If saturated fats are particularly bad for insulin sensitivity, so the things that meats, dairies, butters, the things that are really rich, saturated fats are more solid at room temperature. Those are particularly bad and the plant fats are not that way. So particularly that is true. This is a study looking at insulin sensitivity impaired after butter intake. And this was from the AdventHealth study that a lot of you may be familiar with, 70-some thousand people in the study. And they looked at incidence of diabetes. And from on the left here, if you look at the picture there, is non-vegetarian going down. Green is semi-vegetarian, then pesco-vegetarian was fish, and then lacto-ovo-vegetarian, then vegan. And there was a stepwise decrease in the incidence of diabetes, and it correlates with what we've been saying: less fat, the better off you are from diabetes. So
You're not going to like this one. What do you do with coconut oil?
okay, we'll come to that. So the question is, what do you do with coconut oil? We'll come to the question of oils later in the talk. So I'll come back to this question about what do you do with things like coconut oil. So fat is not only bad for insulin resistance, but it's also bad for the pancreas producing insulin. So it's bad on the receiving end, less insulin sensitivity, but it's also bad. There's the islet cells in your pancreas, the beta cells within there that produce insulin. So if you have more fat, it's actually toxic to those beta cells. So saturated lipids here, this study are harmful for beta cells. And this is a study looking at what happened to glucose levels over time right before the onset of diabetes. And you can see here, this is glucose on the left, and it gradually increased until they were diagnosed with diabetes, and then it shot up. And there was a gradual increase in insulin resistance over the years. The pancreas was pumping out more insulin and until it wore out. And fat got into the pancreas and affected the pancreas' ability to produce insulin. So over time, it was more insulin resistance, but the pancreas was also wearing out because of all the fat within the pancreas. So does the type of fat, whether animal or plant, also impact beta cell death? Like is plant fats not quite as bad as animal fats? What are your thoughts? Yes, where I'm hearing yes. Maybe not quite as bad. So that is correct. The fats you see in animal fats cause more beta cell death than the fats you see in, this is the gray line, oleic acid, which you see in nuts, olives, avocados, are not as toxic. They're not toxic to beta cells within the pancreas.
I have one other question.
Okay, another question. Yeah.
When we looked at the study 100 years ago, and we saw that the fat cells were the more prevalent. Of course, 100 years ago, we had a much more vigorous lifestyle. We worked harder. We tend to walk further. We did things that increased the metabolic systems in our body.
Sure.
Today, we are opposite of it.
Yeah.
We don't walk as much. We don't labor as hard, and we tend to be more sedentary in our lives.
Yeah.
How has that change in our lifestyle affected the increase in diabetes?
Yeah. To repeat the question, 100 years ago, we were much more active when we saw that fat was bad for but yeah, now we're more inactive and probably we're eating much worse than they were 100 years ago. So I think, yeah, all of that plays together. So maybe what I'll do, I'm going to go through, I want to save time. The most important thing is for these three individuals, I'll share some information and you're going to have more benefit from hearing from the three people who are in the study. So I'll open up questions at the end, but I do appreciate the questions. And just to stay on time so they have adequate time to share what they've been through. So what causes type 2 diabetes? This is a review. It says the consumption of a high-calorie diet, rich in saturated fats in the setting of an unfavorable genetic background is the cause of type 2 diabetes. So if you follow that high-calorie diet, high in saturated fats, in the setting of genetics that are not favorable, that is the cause of type 2 diabetes. Can you reverse type 2 diabetes? What do you think? Can you reverse type 2 diabetes? Okay. So I'm hearing some yes, you can reverse type 2 diabetes. Well, the good news is you can, and a lot of folks, not everybody, if you've had it for less, this is a paper here saying if it's, and the majority of people, let me read it from here, it remains reversible for at least 10 years in most individuals. So maybe not everybody, but in most. And this goes on to say, from up to 23 years out, about 50% of people it may be reversible. So the longer it goes, it may be harder. You can always have improvement. Don't let me say that incorrectly. You can always have improvement, but the longer you have it, the harder it is for you to reverse the diabetes. So an overview here, type 2 diabetes, the vast majority are type 2, 99.5% of folks. Type 1 is less common. And what is type 2 diabetes caused by? Fat. Yeah, fat within the cells, right? Fat within the cells causes insulin resistance. And fat is bad, particularly saturated fat is really bad. And how quickly does it cause insulin resistance? Within hours, quickly, yeah. So within 2 hours after a fatty meal, your insulin resistance goes up. All right, so type 1, again, we said is an autoimmune attack. There's a lack of insulin. And the question is there any benefit in somebody who has type 1 diabetes for a whole food plant-based diet? You can't reverse it, but is there any benefit in it? Okay, so I'm hearing some yes. So we'll come back to answer that a little bit more. Cardiac, yes. There's many reasons that would be beneficial. We'll come back to that. So I'm going to highlight a couple helpful hints in people who have diabetes. Number 1, you want to eat oatmeal. Oatmeal is very good. We'll go over some studies on that. Eat beans. Beans are very good for diabetes. We'll go over that. And exercise. I'll go over a few of these studies on that. So oatmeal, this is over 100 years ago. This says no case of diabetes should be deprived of the benefits of an oatmeal cure. So they're saying this over 100 years ago. There's something very beneficial with oatmeal, particularly in people with diabetes. This was in JAMA 1909. This is a case report, somebody who had severe insulin resistance. They went to the ICU. They couldn't get their blood sugar under control. They did 2 days of a strict oatmeal diet, nothing but oatmeal. And their insulin needs went down from 205 units to 42 units, if you can see there. So 205 units to 42 units. So 163 less units of insulin a day. And the glucose was much better controlled, 246 down to 104. So, well, like oatmeal, at least in this one, this is just a case report, so you can't base everything on a case report, but that's pretty impressive. A drop in 163 units of insulin, and the glucose much better controlled just on 2 days of oatmeal. This was a case series, 15 inpatients, uncontrolled type 2 diabetes. The first 2 days was a standard diabetic diet. Days 3 and 4, they gave oatmeal. They only added cinnamon and herbs are the only extra things they could have along with that. And what did they see? Insulin needs were cut in half, basically, about in half. And they noted that even several weeks later, when they checked their hemoglobin A1C, a measure of over time where your sugars are at, there was benefit. So even weeks later, they noticed a benefit after they've been on an oatmeal, 2 days of oatmeal. And then this goes on, this is a review. It says several studies have suggested that the effects could last between 4 and 6 weeks after oatmeal days. So oatmeal has something very powerful, not only when you just eat it, but even after the fact. And oatmeal has been shown to lower fasting glucose, lower the hemoglobin A1C, total cholesterol, and the LDL, the bad cholesterol. All of those have been shown to drop with that. And they think that the benefits is from this beta-glucan, which is a soluble fiber. Soluble fibers absorb water, become gel-like. They slow digestion, they help lower cholesterol, and they blunt the sugar spikes. We also know it's been well documented that gut bacteria fermentation of fiber has a strong anti-inflammatory effect. Short-chain fatty acids derived from bacterial fermentation of dietary fiber have an anti-inflammatory properties. That's been shown repeatedly. So we'll move on from oatmeal to beans. So say beans, they're good for the heart. You hear that? Can anybody finish that off for me? Yeah, sorry, beans for the heart. Beans, good for the heart, right? They're good for the heart, but they're also good for your diabetes. Is there a question? Okay, so the question is the oat beneficial in like more processed cereal? Is that so I think the whole food is always better, but I think if you're eating Cheerios versus Egg McMuffin, I think there's benefits of Cheerios. So yes, yeah. So beans, similar to oatmeal, they have a very low glycemic index. Like the sugars don't go as high when you eat beans. But they also have this like the next meal after, there's a blunted effect. They call it the lentil effect. If you follow this lower line here, it has a lower glycemic index, like less bump in the sugar. But even the next meal, there's a less bump in your glucose. And that's been shown in a number of studies. This is one where they looked at a test dinner where one group had lentils. The next morning, if they had eaten lentils the evening before, they eat the same breakfast, they have less of a spike in their glucose if they had eaten lentils the evening before. So similar to oatmeal, it has a blunting effect after you eat it. Exercise, very similar, it has a blunting effect, lowers your sugars, but also the day after it has a blunting effect. It's been shown. So the helpful hints: eat oatmeal, eat some beans, get a little exercise. So those are things that can be helpful in diabetes. And it's been shown to lower the need for medications. This is a case series. You can see the number of medications dropped from about 4 to 1 in people who adopted a whole food plant-based diet who had diabetes. So it lowers your need for medications. And this was a systematic review and meta-analysis, and it concluded the consumption of a vegetarian diet is associated with improved glycemic control in type 2 diabetes. So there's good solid data on plant-based diets for diabetes. So can type 1 or type 2 diabetes be reversed? Type 2. Type 2 can be reversed. You got that. And I asked this before. Is there any benefits of a plant-based diet for type 1? And you all said yes. So let's go over why that might be. What's the number one cause of death in diabetes? If you had to guess, what's the number one cause? Yeah, I'm hearing heart disease, strokes, kidney. So yeah, the number one cause, it would be heart disease, like it is for the rest of us. And while you cannot reverse type 1 diabetes, you can reverse the underlying issues that they will end up dying from, heart disease and strokes and cancers and such. You can have improvement. So this is a published image out of the Cleveland Clinic, Caldwell Esselstyn. Took a narrowed artery there on the left with a completely plant-based diet. You can see it open up there. So there's good data out of the Cleveland Clinic and in California with Dean Ornish that's been published many years ago that you can have improvement of the number one killer. So there's benefits treating the underlying complications of diabetes. What are some other complications? I heard heart disease, I heard stroke, I heard anything else? Kidney disease, neuropathy, blindness, diabetic retinopathy, anything else? Cancers, yep, pancreatic cancers. Yes, so vision issues. So so these are all the complications you see with diabetes. Cardiovascular disease, kidney disease. I want to highlight that all of these things are really an underlying vascular flow issue. So heart disease is a blood flow issue. Kidney disease is poor blood flow to the kidneys, leading to poor filtration of the kidneys. Retinopathy, damage to the blood vessels in the eyes. You can have bleeds. Neuropathy, 30 to 50% of people after 10 years develop neuropathy. High blood pressure, cholesterol, peripheral artery disease, foot ulcers. All those things really, in a large extent, tie into poor blood flow. Here, this is a case series of diabetics and their kidney function. You can see until they adopted a plant-based diet, there was a decrease in their kidney function. Once they adopted the plant-based diet, it leveled off and actually improved. And we're going to ask Kathy and Keith in just a few minutes, like what was their experience with their kidney function adopting a plant-based diet. This is Sarah, and I invited her. I'm not going to show her video. I invited her here today, but she couldn't come. She's a nurse at Mission Hospital, and she's a type 1 diabetic. And while you cannot reverse type 1 diabetes, you can have a marked improvement. So she's in her early 30s, and this is probably within the last year or two she adopted a plant-based diet. She told me at night her sugars are so out of control. Every 1 to 2 hours she would have to wake up to kind of check her sugars if it was too high, too low. So for 30 years she's been waking up every 1 to 2 hours at nighttime. Either her parents would wake her up or she would set the alarm to wake herself up to check what her sugars were. And then she wake up. She had retinal bleeds. We talked about 7 bleeds in her eye. She had to have her eye zapped. The periphery of her vision. She lost the periphery of her vision to maintain her central vision. And she adopted a plant-based diet. And she tells me within the first day, she started that morning, like things leveled off. She was actually able to sleep through the night without having to wake up. And so, like she said, she thought it'd take like weeks or months or whatever, but she said the first day she was able to sleep through the night. First time like in 30 years she hadn't slept through the night. And so if you want to go on, so if you want to hear her full testimony, you go on YouTube, MedInfo Lifestyle Medicine. And actually these talks will be on there in the next few weeks, what we're covering today. She is a powerful, and not only that, her insulin needs decreased by 50%. So how could a type 1 diabetic who's not producing insulin need 50% less insulin? Any guesses why that might be? Less fat? Yeah, so there's less fat. The insulin, the muscle cells are more sensitive. They can use the glucose more efficiently, and so that she didn't need as much insulin. So while she couldn't produce insulin, it was more efficient at using it.
Would her blood flow be increased also?
So the question was, could her blood flow be increased? And yes, absolutely. A plant-based diet improves blood flow. So diabetic neuropathy, another complication, which we're going to be spending a little bit of time here on. 30 to 50% of people with diabetes will, within about 10 years, develop diabetic neuropathy. And what do you think the underlying cause of diabetic neuropathy is? Anybody want to venture a guess? Blood flow, yes, you got it. It's all a blood flow issue. Like the microcirculation to the nerves in the feet, poor oxygenation, and it injures the nerves. They're not getting enough oxygen. They get injured. You get numbness. Sometimes it can be painful. And many studies have shown that. So these are 3 studies I've put up here showing that the microcirculation to the nerves is the underlying issue with diabetic neuropathy. There's another study showing the same thing, and a third study, the vascular factors in neuropathy in diabetic patients. It's all a blood flow issue. So if you could improve the blood flow, hey, maybe the neuropathy could improve. So what are the common treatments for diabetic neuropathy? Anybody want to venture a guess? What do people typically get if you go to the doctor? You have diabetic neuropathy? I heard gabapentin. Yeah, so medications are kind of the common thing you go to the doctor. So medications, probably the most common would be gabapentin and Lyrica would be the more common ones that are used. Antidepressants are used. There's a couple different classes of antidepressants that are used. And the most common, I heard somebody say gabapentin. And you look at the big studies, like how much does gabapentin really lower pain scores in neuropathy? It's marginal. Like if the big studies showed about a 2-point drop in pain and neuropathy, and placebo dropped at a point. So maybe a point. So there's a minimal or modest improvement with medications. Now, so those studies do show that 30% of people may get 50% reduction in pain. So there's a subset of people that do very well, but as a whole, they're probably more modest in how effective they are. A question.
What do you think about laser treatment?
Laser treatment for neuropathy. So the question is, what about laser treatment for neuropathy? I'm not aware of the data on it. Doesn't mean it's not effective, but I'm not sure about the data on laser therapy. Like you're talking like the red light type stuff or infrared. Oh, yeah. So we actually, you come on Wednesday, we're going to talk about that type of thing, the infrared and light therapy and that type of thing. There's a lot of interesting studies on that, but for neuropathy, I'm not. It could be, but I don't know. Yeah. One more question. Yes. Yes, so good question. You're asking like side effects of gabapentin. So I've actually listed those up here. Lyrica is similar. I'll come to your question in just a second. Lyrica probably, the more commonly prescribed dose is about a 2-point drop. But 77% of people within a year stop taking Lyrica because either it's not effective or there's side effects with it. And so the side effects, you're asking about side effects with these are anti-seizure medications that are really used for pain. Dizziness, drowsiness is 15 to 20% of people. Swelling in the ankles is not uncommon, but really more at the higher doses. Weight gain, again, more at the higher doses. And there's more recent studies that maybe cognition long-term not as favorable. The antidepressants, the SNRIs, serotonin, norepinephrine reuptake inhibitors, they are the only one that's FDA approved for diabetic neuropathy is Cymbalta, duloxetine. And probably about a 2-point drop as well at the standardly given doses. But the side effects of the antidepressants, a lot of GI side effects are common. High blood pressure, it affects norepinephrine, so there's more norepinephrine, raises your blood pressure. Sexual side effects are common, about 50% of people. And same with the older antidepressants. Some cognitive slowing is seen more so with those, sedation, and some sexual side effects with those. The other thing that's sometimes offered are stimulators you can use for spinal cord stimulators that FDA approved, but how they can be effective short term. There's like 2-year follow-up, so we don't know how long they last. But that's another option that's out there for you to go to the doctor. You can do, but this is a surgical implant, so it's more invasive of something to do. And yeah, I'm not. So the question is, how about hyperbaric oxygen treatment for neuropathy? I'm not aware of the data on that. Maybe somebody else does know the data on that for neuropathy. Are there any other options? So these are the standard things. You go to the doctor, hey, what can I do for my painful neuropathy? You just saw everything that's really out there that's typically done. Are there any other options? So if you go on Google and say, can I reverse diabetic neuropathy? And Google says, this is what I got. It says, no, there is no cure for diabetic neuropathy. Well, if you go back to, this is from the 1990s, the Crane and Sample, they did a study. This is out of Weimar. They did a live-in program. It's a case series of people who had diabetic neuropathy, and it was published in a journal you can't even find, so it's not really well known. But this is what they found, that in a 21 patients in a 25-day live-in program, 17 out of 21, about 80% of people had reversal of the painful neuropathy. The numbness persisted. This is only 25-day, but it did improve during the 25-day live-in program. And then those who maintained it did even better, farther follow-up. and 71% of people actually continued it once they completed it. And so what did they do? What was their formula for helping the neuropathy? This is what they did. In their paper, that says it was a plant-based diet. They excluded meat, dairy, eggs, oil, butter, sugar, and meat substitutes. So they excluded all of that. They allowed nuts and olives and avocados as long as the weight was optimal for their height. I'm going to get a drink of water real quick. So this was in the early 90s, so it's been quite a few years ago. But most people are not aware. This is not like a highly published study and not aware of it. There was another study that was presented but never published. David DeRose, which I have talked with, and he told me about, but similar outcomes like marked improvement in a case series of patients in a live-in situation. So they noted that the pain improved quicker than the diabetes did. And so the question is, why would the pain improve more quickly than the diabetes, the glucose control? And they summarized, they thought that it was likely improved blood flow occurred more quickly than the diabetes control got under better control. So they thought it was a vascular flow issue, as we've already mentioned. So can vascular disease really be improved? Well, again, out of the Cleveland Clinic and University of California, San Francisco, Caldwell Esselstyn and Dean Ornish, 70 to 82% of people saw opening of their arteries on a whole food plant-based diet. 99% of people even did better symptomatically, even though they didn't always see opening when they repeated imaging. And these are some images. Now, there was one randomized controlled trial, kind of more gold standard for diabetic neuropathy with a plant-based diet, and it was a 20-week outpatient study. And just to highlight this was there was improvements in a pain questionnaire that was quite notable. But interestingly, their pain scores didn't change as much. It was a 1-point drop in pain versus a 2-point drop in pain. So it was not as marked as what we saw in the 2 prior studies I'd mentioned. So why was that? I'm going to come back to why I think that is in just a minute. So what's the difference? There were some improvements, but not marked. There wasn't a big change in pain scores. So we're going to talk about our clinical study here, so that we're doing time we have. Okay, so in our current study, we're going to present this in August at. Does anybody know Neil Barnard? Have you heard of Neil Barnard? Yes, we're presenting it at his conference in DC in August, and Dr. Sven Johnson and myself are doing this study at AdventHealth in Hendersonville, and it's a 2-month study. Plant-based diet randomized versus standard medical management. And our recipe for what we're doing is kind of repeating what was done previously. A whole food plant-based diet, avoiding meat, red and white meat, no dairy or eggs, no oil, nuts are okay, avocados are okay within moderation. And why are we excluding like oil? Like oil's not the worst thing ever, but the study that didn't show any improvement, they did not exclude oil. And the only thing that's been shown to reverse vascular disease at the Cleveland Clinic and in California is when they excluded it as well. So we're just repeating what's already been done in the past. We're just kind of repeating what they did. And then this is within the last year, this is a study that came out, plant-based diet, when they added I think olive oil, probably the better of the oils, right? It's like a lot of polyphenols, probably a better thing compared to other oils. Well, the total cholesterol bumped up 29. When you went from a plant-based diet without oil and you added it in 3 tablespoons a day, the total cholesterol bumped up 29 points, LDL bumped up 16 points, and fasting glucose was worse. So you can see here on the left, total cholesterol bumped up, LDL bumped up here in the middle, and then the fasting glucose was worse. So this is saying maybe olive oil is not the best in the setting of diabetes and cholesterol. And then olive oil has been shown to decrease arteries' ability to dilate by 31%. That was an older study out of the University of Maryland. And the PREDIMED study, which is one of the more well-known Mediterranean diet studies, they had a control group, which was like just a Mediterranean low-fat diet versus Mediterranean with added nuts versus added olive oil. And it was the nut group that did better. The olive oil group, when they scanned their carotid arteries, there was actually worsening of their carotid arteries over time. And you can see that on this scan, this picture on the right. On the right is the nuts had improvement of their carotid artery thickness, where the extra virgin olive oil here in the middle did worse, as did the control diet. So anyways, that's why, why are we doing? That's why, because we're just repeating what's been done before, and it's probably not helpful in the setting of diabetes and blood flow. Again, Crane and Sample, they excluded the oil. The Bernard study and Bunner study, they did not, and they didn't see difference in pain scores. So again, olive oil, again, this is not the worst thing ever, but for what we're doing, probably not the best. 14% of it's 100% calories come from fat. 14% of it is saturated fat. And myself and two other, Dr. Johnson and his PA, we did a little experiment in clinic. We did the Mediterranean diet. They usually call for about 3 tablespoons of olive oil. And so we did that. We did a fasting glucose, and then we did 3 days of the olive oil, 3 tablespoons, and then we all checked our sugars, fasting sugars again, day 3, well, after 3 days. And we all went from normal to pre-diabetic. All of our sugars, like 3 for 3. So we're doing a study. We're going to get IRB approval to do that bigger study. But in our case series, it was not as favorable. We all, 100%, 3 of 3, went from normal to pre-diabetic in our fasting sugars. So that's why we decided, hey, we probably, in our study, we would exclude oil. So can you reverse diabetic neuropathy? If you ask Google or AI, it'll say no, you can't. But we have studies that, yes, you actually, some case series, this is data from our study. So the orange line here, if you're looking, is the medical management, like the gabapentins, the Lyricas, Cymbaltas. The blue line is the diet intervention. So within 2 weeks, marked improvement. So the pain score is up around 6 to 7, dropping down close to 1, and landing around 1 at the 2-month mark. And if you look at what percentage of people got at least 50% reduction in pain, this is the left graph, 100% of people got at least 50% reduction in the pain, and 86% of people got at least 75% reduction in pain. So it's not like mildly helpful, it's markedly helpful. So in review, what is the underlying cause of diabetes type 2? Anybody want to venture a guess? Fat in the cells, yeah, intramyocellular lipids, so fat within the cells. How quickly does a high-fat meal cause insulin resistance? How quickly does that occur? Within 2 hours. Peaks at 6 hours, but within 2 hours it causes insulin resistance. And what foods have a blunting effect on diabetes? Yeah, oatmeal and beans, right? Oatmeal, exercise is also good, but and then we talked about the underlying cause. Okay, so that's it. We talked about type 1, type 2 diabetes, helpful hints. And then all major complications from diabetes, there's a vascular link, right? It's underlying vascular cause. And diabetic neuropathy is treatable in the vast majority of people. So what I'm going to do, I'm going to invite Dr. Tryon to come up, and he's going to interview. We've had 3 of our patients in this study come today. So thank you for coming. Kathy, Chris, and Keith have all come today, and they're going to share their experience with what they've experienced changing their diet. So I'll turn it over to you, Dr. Tryon.
Sure.
You got to. Yeah.
This is right here.
Oh, this one. Okay.
Yes, it's on. It's not yet. I think it's important that we have this scientific evidence to see what is going on. It's extra special when we see the people that actually have been through it and what it means to them. So, Kathy Lewis, I wonder if you would mind coming up here with us. Tell us a little bit about what's going on. Let's see, we were talking earlier. You've been told you have prediabetes or diabetes, and you have?
Yeah, I probably was diagnosed with diabetes close to 30, 35 years ago. And it just progressed from taking gabapentin to being on insulin a couple times a day to being on insulin 3 times a day. And neuropathy, of course, got worse over the years. I probably had diabetes for 10 or 15 years before the neuropathy really started. But by the time I went to see Dr. Beckworth, it was just excruciating. It was all night sometimes that I couldn't sleep. My feet burned and itched, and just I was miserable, and nothing I did. I could take all the gabapentin in the world, it wouldn't go away. And so once I got to see Dr. Beckworth, he started me on the plant-based diet, and literally within days, I could tell a difference in the neuropathy, in the pain and the burning. And even now, I don't stick to it 100%, I have to admit. I eat dairy sometimes. Occasionally I'll eat an egg, but I don't eat meat normally. But I can tell that, man, you eat some pizza and you're going to have neuropathy that night. That oily, greasy pizza is going to show up about 10 o'clock at night, and there's nothing you can do. I've been on gabapentin, I've been on Lyrica, several things, and nothing is going to take that pain and itch and burn away. So it's absolutely the oil in the diet is the main thing. It's not the sugar that we've all been told sugar is going to cause you to have neuropathy and diabetes, but it's not the sugar so much as it is the oil. And if you start looking at ingredients on anything, almost everything has oil in it, some kind of oil. And so that's the thing to be careful of, really, is that oil in your diet. It really does cause the neuropathy. And so for me, it has been a 95% change in the pain and just the burning and the misery of neuropathy.
Thank you for telling us that. Now, let's see here. With diabetes, you start having an A1C above 6.5. You're getting concerned. Your A1C has been up to as high as?
Years ago, it was up to 14. It's a wonder I didn't die. But I was not paying attention to what I was eating. I was eating those peanut M&Ms like crazy. And nobody had ever really said or done anything except, here, take this pill. Take this pill. And that's not the answer. And
so a more recent A1C has been down to as low as how?
5.6.
5.6 is not even pre-diabetes. Give her a hand. What do you say?
Thank you, guys. Thanks.
We're not done. Oh, okay. We also have some other problems that you had. You were starting to get into trouble with another part of your body because of the diabetes. What was that?
My kidney function.
And so your kidneys were going down the tubes.
Yes, and going down fast. And one of the surprises with this diet was that my kidney function improved. It went from, Dr. Beckworth knows the numbers,
the creatinine of 1.8 down to 1.2 in a fairly short time, and really made a significant difference.
I think it did that within the first month or two. After the first month, we could tell a difference. But by 2 months, it was a drastic difference. And it stayed there, And like I said, I'm not 100% with this diet. It's hard sometimes to not eat ice cream and not eat yogurt. And that was a thing I did every night before I went to bed. I thought, I'm going to have some yogurt. Well, that's dairy. That's fat. So eating regular yogurt just caused neuropathy to be worse. But I've discovered coconut-based yogurt. There's tofu cheese. There's lots of things you can do to get away from the dairy. And one thing I've discovered is I love ice cream, and that is one of the worst things. So I've discovered sorbet. And you can make your own sorbet really, really fast. And it's, there's some sugar in it, and you can decide how much sugar you want to put in it. But it's fruits, so it's good things, and it's much better than eating ice cream every day.
two more questions. What did you first think when Dr. Beckworth said, I want you to go on a no animal, just a plant-based diet and eat oatmeal and beans? What did you think of him when he said that to you before you tried anything?
What I thought was, I can't do this. This is impossible. How can you get away from eating any animal fat, any plant fat, really, except you can have an avocado a week, which I cherish. I really look forward to that one avocado a week. I got one ripe on my counter at home. And so I just thought, there's just no way. Just no way you can do this.
Are you going to go back now to the old ways?
No, because I am not an idiot. And and I know that if today at lunch I eat a bunch of oil or I eat ice cream or whatever, then tonight when I go to bed, my neuropathy is going to hurt. It's going to be miserable.
Your life has been changed and blessed for the better.
Yes. Thank you, Dr. Beckworth and Dr. Johnson.
Yes,
Yeah,
that's right.
they've been great.
Thank you very much. Chris Zomosa, are you able to come up here? Come on up, Chris. We're looking forward to how your life has been changed as well. I find this is a special part of the service. Don't you think so? Chris, tell us a little bit about your experience, how you first found out you maybe had diabetes and neuropathy and other things that you'd like to share with us at this time.
So I approached Dr. Sven Johnson in Brevard about 3 years ago. I weighed 250, and I had not seen a doctor for about 20 years. I rated my neuropathy pain in my hands and feet at 8 out of 10, and that was constant. So it was a shock to me that I was diagnosed with diabetes because I thought I was eating a relatively healthy diet. I didn't go out, I didn't eat burgers, but I loved pastas, breads, potatoes, and I loved oily fish and bacon, and I would save the grease and spread it on everything. So we started with medications to drop the blood sugar levels. I never did take any medication for pain, and I went immediately into the diet, whole plant-based foods. And I lost 70 pounds in the first year.
What do you say?
And my neuropathy now is 0 or 1. Dr. Johnson, I'll tell you a little story. When my labs came back, Dr. Johnson held the paper and he couldn't get away from it. It shocked him. And he turned to me and he said, "Do you have a will? Go make a will." That's how serious my labs were. My A1C was at 11. I'm at 5.3 nowadays. No medication.
That looks like not even a diabetic now.
It's controlled. Yeah. So my life, I want to share that there are ways to a healthy life that don't involve drugs, and it's cheaper, and it's effective, and it will change your life. You can have a life.
How about your cholesterol? What happened with your cholesterol when you went on this program?
I was called hyperlipidemic, meaning they were just out of control. I don't take any statins at this point, or my cholesterol is very low, less than, I don't really know what the numbers are, but it's considered very low.
And would you ever go back to the lifestyle you had before now that this has happened to you?
No, not at all. I would be looking at close to dying.
Yes. Your life has been spared, your life has been changed, and we're so happy you shared your testimony with us today. Thank you.
Thank you.
Keith Otten. Come on up and share with us a little bit your story. We're anxious to hear all the things that have happened in your life as far as the diabetes and neuropathy is concerned.
Well, I met Dr. Beckworth. Mary had a problem with her sciatic nerve, and I went and started talking to Dr. Beckworth. I was in a wheelchair, and he told me to buy an Instapot, handed me a recipe that had some cookbooks listed on it, and that's where we started. Then he sent me to Dr. Johnson, and I was taking 130 units of insulin a day. In 9 days, I was taking none after this diet started. So I don't know about my diabetes. I became diabetic on my 65th birthday, 10 years ago. I was 14.5 A1C, 417 glucose level. Now, my dad had it, and my uncle died from it. So I think it was a little more than diet because I didn't use sugars or fats. But anyway, after I got on the diet, I lost 45 pounds. I got out of the wheelchair with circulation improvement in my spine. My neuropathy, I hated it. I loved to drive, and I'd have to pull over on the side of the road and stomp on my foot to get rid of the pain. It's gone. It's just unbelievable.
Praise God.
6 years in the wheelchair, 10 years on insulin. So,
How many times were you stabbing yourself?
4.
What was that question?
So, yeah. How many times were you injecting yourself with insulin?
How many times a day were you needed to take insulin when you were
4
taking?
times a day.
Yes.
So it's all gone now.
What about your sleep patterns after the neuropathy began treating this way? Did any change that way?
Well, it never, my big problem was when I was driving, my toes would burn. When I was laid down at night, I'd get a discomfort in my feet. I'd just get up and walk around. But no, I sleep all night now. It's good.
Are you feeling like it's time to go back to the old lifestyle?
No. Dr. Johnson told me if I wasn't on the diet, I wouldn't be here today because I was such a mess. I have cardiovascular issues. I had kidney issues that the diet corrected. Circulatory in my legs. I have stents in this leg from years ago. I had a heart cath not too long ago, and it showed no blockage whatsoever. So I was pretty happy about that.
Thank you very much. Anything else you'd like to share?
Yeah, it's an easy choice. If you like salads, eat salads. I like them.
What do you say to these 3 testimonies here today?
All right. Well, we will. What time do we have here? We got a few minutes. If there's any questions, if not, we can. Okay, we'll take maybe 5 minutes of questions, then we'll close it up here. So I saw a hand in the back.
On Instagram and social media, so don't eat oats because they're you got.
So the question was, on Instagram, you saw that oats are bad for your sugar. Well, I would say the data says just the opposite, that oats are good. Oops. But, yeah.
How do you reverse kidney function?
So two of Keith didn't highlight this, but his kidney function, just like Kathy's, markedly improved. Again, it's a blood flow issue, so a healthy diet that's the best thing you can do. So like you're talking about the filtration rate, the estimated GFR. I mean, everybody's a little bit different. Not everybody has reversal. I mean, I showed you a case. I don't know if you saw. Yeah, I mean, we don't have long-term outcomes, but I don't know if you saw, there was a slide I showed there was like worsening kidney function. They changed. There's probably, 10 people in that study, and it changed and it leveled off. Some of them actually got better. So everybody's a little bit different. But yeah, you have a question in the back.
Whenever I started out, my A1C was 10.8. And my LDL was and my HDL was pretty much at the bottom of the screen. Now but they put me on 2 forms of insulin and plus 1,000 unit or milligrams of metformin a day, lipizide, and I take 2 of insulin. Well, all of a sudden my blood sugar started going down the opposite way, and my A1C went down to 4.6.
Wow. Okay.
They took me off of the insulin, told me to stay on the metformin and glipizide, but they put me on Trulicity. Now I'm having bouts of severe abdominal pain, nausea, vomiting, and I'm just getting weak. And so it's just, it really started with my Trulicity. Is that Trulicity a concern?
So I might defer you. I'm not a primary care doctor. I just want to caution. I stay in my lane here, but I would just chat probably with your primary care doctor. Now, you bring up a good point. When you make dietary changes and you're on insulin, you got to be very careful. People end up in the ER because their sugars bottom out. So it can be very dangerous. And in fact, Keith, he got off 130 units in 9 days because he had to. It was dropping so low. And his sugars, he didn't have, but it's much better controlled once he made the changes. But you have to be very careful when you do these things because sometimes they can have such a good effect. Your glucose drops so low. Yes.
I don't like cooked oatmeal, but I like raw oatmeal and muesli. Does it make a difference?
I think either. So the question is cooked or raw oatmeal? I think they're both good. Yeah. Oh, I'll come to you next. Yeah. Yeah. I think anything is good. It's better than eating an Egg McMuffin or whatnot. You get like quick cooking oats, they'll probably absorb quicker and a little quicker spike. But if you're eating oatmeal, I think you're good.
So do you have any support group for diabetics?
I don't have a support group for diabetics. Maybe somebody else in here does, but I don't have any. You had asked a question about coconut oil. Or weren't you the one that asked about coconut? Oh, you did. I'm sorry, coconut oil. So coconut oil, of all the oil, it is highly saturated more than other ones. So I would say from a diabetic perspective, probably not the best. Yeah.
I just wanted to make a suggestion. As you well know, Dr. Johnson is my primary care doctor. I agree, when I go in for an annual, are you still using that oil? Get ready to leave, get rid of the oil.
Gotcha. So the patient of Dr. Johnson kind of sharing some experiences here with Dr. Okay. Any other questions? Yes. Say that one more time.
Is the diet that you propose, is that available for general consumption, or is it just something?
Yeah, there's no copyright on it. It was just a plant-based. I kind of highlighted for the study what we were doing is a plant-based diet, so avoiding any meat, dairy, including no eggs, avoiding butters and oils is basically it. So it's pretty simple stuff. And there's you can eat lots of good things. It may sound, but you can get some really good recipes that it's not like you're eating cardboard or something. Yeah. Okay. The question is, how do you get a hold of those cookbooks? Yeah, there's you can even go online. Like what I often do, I'll go on Google or I'll go on ChatGPT or AI and say, give me a recipe for XYZ. And sometimes I'll just do that. But you can find The Esselstings have a lot of cookbooks. Their son has a Rip Esselstyn has a good cookbook, and there's. If you catch me, I can give you a list. I have. Maybe catch me tomorrow. I'll bring some handouts of some cookbooks so you could look at. Yeah.
Are you aware of any research on high cholesterol and red yeast rice?
Do you want to answer about question about high cholesterol and CoQ10 and red yeast? I think I'll defer.
I've seen red yeast rice work some. I was not as impressed with it as I had hoped I would be over the last 40 years. I think the lifestyle management is really the way to go. Really, the more we invest in God's original plan, we all can relook at our life, new start, nutrition, exercise, water, sunlight, fresh air, rest, stay away from things that are bad for you, trust the heart of God, and attitude makes a big difference too. But I really think the more we choose to invest and say, God, live inside of me, help me to find your original plan for my life, it makes a difference.
All right. Well, let's close with a word of prayer. And just a reminder, tomorrow we're talking on popular diet. What's diets? What's the data on each of those? What are those things? The Adventist Advantage, Dr. Tryon is going to talk about. Then light as medicine and hydrotherapy Wednesday. And we'll have a handout in the back. I think we may have run out of them, but tomorrow will be of all the programs. So let's bow our heads. Father in heaven, we're so thankful for this day of life. Thank you for camp meeting. Thank you for the opportunity to come together and to share and to learn. We just ask that you'd be Lord of our lives. Walk with us as we go from here. We pray this in Jesus' name. Amen.